Hello, guys, and welcome to Health Awareness TV, where public health matters. I'm your host, Duncan, and today we'll be talking about hypoglycemia or low blood sugar, causes, signs and symptoms, what to do in the event that you find yourself in that state, and preventive measures. So, low blood sugar occurs when your blood glucose level falls below 3.6 millimole per liter, or if you're using a unit of milligram per deciliter, then it will be below 70 milligram per deciliter. So some of the causes of the obvious common causes of hypoglycemia include taking a too little amount of food. Another one will be too much insulin or diabetes medication. And lastly will be too much exercise, especially if you're a diabetic patient. So what will how will somebody present and for you actually to know that this person is in hypoglycemic state or has low blood sugar? So one of the common signs and symptoms that you'll note when a patient or somebody, your loved one, is in a state of hypoglycemic will be shaking. The person will present with shaking. And another thing, you'll note that the heart rate will be elevated. Person will have a fast heart rate, fast heartbeat, and they will be sweating. Sweating is one of the signs and symptoms. Another thing will be that person will be complaining of dizziness. The person will be complaining of dizziness, and they will be experiencing a blurred vision. Blurred vision is another point. And there is a fatigue, or we call it weakness. The person will be feeling weak, fatigued. They'll be hungry. So if they're in a position to talk to you, they'll mention that they're feeling very, very hungry. And at some point, it's accompanied by headache. And to some extent, the person will be irritable. So then these are just some of the causes, some of the signs and symptoms. We might be having more, which actually we'll keep mentioning at some later episodes. And a person might not present with all these symptoms. So just look out at some of the mentioned symptoms that the person might present with. So it's not that guaranteed you'll see a person presenting with all these, 10, 12, 15 symptoms for you to know that this person is in a state of hypoglycemia. No, not some of those symptoms the person might present with, probably 1, 2, 3. Yeah. So let's see, if you're in a position, you have a friend who is in a hypoglycemic state, has a low blood sugar, what can you do? And you're far from the hospital. So what you need to do is you need to check the blood sugar level, if you're in a position to do so, if you have the machine to check the blood sugar. And after you've checked your blood sugar and you've seen that it is actually low, then the person needs to consume either of the following. One, the person will need to take half a cup of fruit juice, or the common soda. Or this person can take 2 to 4 teaspoons of honey. Or the person can take sweets, 2 to 3 sweets. And after doing that, don't consume, don't take a glass, half a glass of juice, and then you take 2 to 3 spoons of honey and sweets. No, take either of those 3. And then after that, check the blood sugar after 10 to 15 minutes to see if there's any change. Once the person feels better, then actually can take a proper meal. But now, what if you do after those 15 minutes, you check the blood sugar and you find out that it is still low, let's say below 4. It has just peaked, probably it was 3.5 and it has gone to 4. That one is still low, yes. So what can you do? What you need to do when you recheck and you find the blood sugar is still low, then repeat one of the points that I had stated earlier on, which is take a half a cup or a half a glass of juice or soda, or take sweets or take 2 to 4 teaspoons of honey. After you've repeated that, then seek medical attention. So we'll finish off by tips that will help you to actually prevent the occurrence of hypoglycemia. So one of the points that you need to note is always take medication with meals. Always take your diabetes medication with meals. And if you're on insulin, especially fast-acting insulin, then make sure you actually take them before meals. Take your insulin before meals. Number two will be, if on insulin, have a light snack before bedtime. Make sure to have a light snack before bedtime. You can take like a cup of tea and a diabetic snack, or just a cup of tea. Yeah. So have something before you go to sleep. And another point, which will be the third point, is avoid skipping or delayed meals. So when it is lunchtime, make sure you take your meals. When it is dinner time, take your meals. Stop skipping your meals. Probably say, I want to skip lunch and take dinner. No. Ensure you take your meals consistently. The last point will be, as a precaution, always carry quick-acting snacks, quick-acting sweets, whenever you actually exercising or your outdoor events. So make sure to carry sweets on your pocket. So guys, that is all about hypoglycemia in a nutshell, the simplest way possible. And if you have a question about hypoglycemia, if you have an additional point about hypoglycemia, please feel free to comment below so that actually other people can get to learn more about hypoglycemia. And as we do so, we will be improving our own health and our own living. So thank you very much, guys. I've been Duncan, and until next time, bye.